Okay, these are a few of the items or the items that we're going to go over today. Your medical choices with United Healthcare, your dental options with Delta Dental, your vision option with Delta Dental using the iMed network, and then your Unum voluntary products and your Aflac voluntary products. At any time during the presentation, if you need to ask a question, please feel free to do so. If you need to step away, please do so. Don't put us on hold because we will hear that lovely hold music. Okay, your open enrollment period starts today. What that means is, as of today, you can enroll, add any dependents, terminate your coverage if you would like to do so. So we'll go over the enrollment packet and what needs to be completed. And then we ask that everything be returned by June 22nd to our office so we can process any changes, and that all changes will be effective July 1st, 2020 until June 30th, 2021. Few housekeeping items here in regards to eligibility. So who is eligible? All employees working 30 plus hours. And also, in this case, part-time employees. In regards to who else is eligible, your legal spouse, domestic partner, and children up to the age of 26. And as I stated earlier, any changes that are made or enrollments that are made are effective July 1st and will run for a full 12 months. During those 12 months, you cannot make any changes to your plans unless you have a qualified event. And here on the screen, you see a list of those: so marriage, divorce, birth of a child, adoption, things of that nature, loss of coverage. And you have 31 days from the date of that event to notify your team here at CBR, your HR team, that you would like to make changes or review your options. Keep that in mind. It's very important that you do not exceed those 31 days. If you do, then you have to wait until the next open enrollment period to make any changes to your medical, dental, or vision. We're going to go over the United Healthcare benefits. No changes to last year. If you're enrolled today, you would probably still just roll over to the same plan. If you'd like to move from one plan to another or add dependents, this is definitely the time to do so. So we'll go over the first plan, the United Healthcare. It's a $3,500 deductible. This is an HSA plan. What that means is you have the ability to open a health savings account and use those dollars to pay for your medical services. So this plan is a $3,500 individual deductible and a $7,000 family deductible. If you meet that deductible in the plan year, then you're going to go into coinsurance. And at that point, United Healthcare will start to pay 80% of the cost and you pick up 20% until you meet your out-of-pocket maximum. In this case, it's $6,150 for an individual, $12,300 for the family. Keep in mind for your out-of-pocket maximum, all of your out-of-pocket expenses aside from your premiums go towards meeting your out-of-pocket maximum. Preventative care on both plans is covered at 100%, and that is not subject to your deductible. So when you go in to get your well man, well woman check or well child check, those are all free before the deductible, so there should be no out-of-pocket expense. Should you run into issues during the calendar year when you go to get your preventative exams, please feel free to reach out to me. Send me the explanation of benefit or a bill that you may be getting from UHC, and I'll be happy to discuss it with UHC on your behalf. On this plan, you are going to be subject to your deductible for your office visits, your specialist visits, your urgent care visits, and your emergency room visits. You can use your health savings account to pay for those visits. Just keep that in mind. You do have to show your UHC ID card when you seek those services so you get the contracted negotiated rate. Very important there. During this time right now with the COVID-19, all virtual visits are going to be at no cost. So I would recommend virtual visits whenever possible. Sometimes doctors will even schedule med checks, virtual visits, things of that nature, follow-up visits. Those are going to be at no cost. So I would recommend virtual visits or telemedicine whenever possible for non-emergency services. Prescriptions are also going to be subject to the deductible with the exception of preventative drugs, maintenance drugs, and FDA-approved contraceptives. All other medications are going to be subject to your deductible. If you are on some expensive medications, you can visit the site GoodRx, either download it to your telephone or go on the website, type in your zip code and the prescription you're taking, and it'll find the pharmacy that's closest to you and it'll show all the prices. Since it is going to be your dollars first, it's a really good app to have. Also, the pharmacy in Costco is a standalone pharmacy. You do not need be a member to get the savings there at Costco. Any questions on this plan? Okay, I'm going to move on to the next United Healthcare plan. This is another option that stayed the same. So this one has a $1,500 deductible for an individual, $3,000 for the family. And again, that coinsurance comes into play when you meet that deductible. On both of these plans, if you just go in for your preventative and maybe you have some maintenance medication and FDA-approved contraceptives, you really don't have any out-of-pocket expenses other than your premiums that you're paying per payroll. And you will not be subject to the deductible if you don't have any of the major services. The other plan, you will always be subject to the deductible even with regular doctor visits. So going back to the $1,500 plan, again, $1,500 deductible for an individual, $3,000 for the family. If you meet that, then you go into the co-insurance or cost share with UHC. Again, same 80-20. The member picks up 20%. United Healthcare will pick up 80%. And then the out-of-pocket maximum is $6,000 for an individual, $12,000 for the family. And again, all expenses, prescriptions, co-pays, all of that goes towards meeting your out-of-pocket maximum. Similar to the other plan, your preventative care is covered at 100%. On this plan, you do have co-pays for your doctor visits, your walk-in clinics. It's going to be $25. Your specialists are going to be $50. And on either plan, you can self-refer to specialists. You do not need a primary care physician to refer you. Urgent care on this plan is a $50 copay. Your emergency room on this plan is going to be subject to that deductible. So again, we'd like to stay away from the emergency room whenever possible. Use your virtual doctors, your telemedicine, urgent care for items that can be treated in urgent care type setting versus the emergency room. Obviously, if it's loss of life or limb, you want to get to the emergency. If you notice on both of these plans, the emergency room is the same in and out of network. That is a change with healthcare reform. So if you're traveling and God forbid you need emergency services, it doesn't matter what hospital you walk into or are taken to, it will be considered in network. On this plan, you do have co-pays for your prescriptions before your deductible. You can still use GoodRx to get the least expensive medications in your zip code. It's still a good practice, so you can save some money. But you do have co-pays there. Your generic drugs are going to be either the lesser of $4 or $15. Some pharmacies, such as Walmart, Fry's here locally, they have $3 and $4 generics. I would go with those versus $15. Preferred brand names are $45, non-preferred brand names are $90, and specialty medications are $350. And then you have retail mail order at 2.5 times the copay. So a little bit of a savings there for that 90-day supply. Any questions? Okay. We're going to move on to a high deductible health plan and how that works. Some of you may already be enrolled in that plan, which is great. This is kind of a refresher for some of you. For some of you that are considering, it's a really good option. So an HSA or health savings account, we administer internally with UMB Bank. We have a partnership. So you just indicate on your form how much you want to set aside or how much money you want to go in there. The company does contribute to your HSA as well. So keep that in mind. High deductible health plan, you must be enrolled in the UHC 3500 plan in order to take advantage of the HSA banking or the HSA account. It is pre-tax dollars if you elect anything from your paycheck going into that account, so that lowers your taxable income. Very important there as well. This is your account, this is your money, it goes with you, it stays with you. There is no use it or lose it provision. So if you leave the company, you take it with you. If in 2021, when we come back to open enrollment, you decide not to enroll in the high deductible health plan, you can still utilize those dollars to pay for services. You just cannot add any more. Okay, you can also use those dollars to pay for dental services or vision exams or eyeglasses. You can use those dollars for any of those items, and of course your pharmacy. A couple of quick notes. So the IRS does set annual limits for the 2020 plan year that we're currently in. If you're an individual, the maximum you can put into that account is $3,550. And if you're a family, it's $7,100. Under IRS rules, a family is going to be considered one plus. It could be one plus a child or one plus a spouse or an entire family. If you have a spouse that's also enrolled in a high deductible health plan, combined you cannot exceed the $7,100. And if you're 55 plus, you can add an additional $1,000, making it $4,550 and $8,100. A couple of rules the IRS sets. Number one, you must be enrolled in the high deductible health plan, which you have access to here. You cannot be covered by a different plan that's not considered a high deductible health plan. You cannot be enrolled in any part of Medicare, and you cannot be somebody else's dependent on their tax returns. Flexible spending account. This is just a reminder or a refresher. So this is something that we approached everyone in October-ish, end of last year, to enroll in the flexible spending account. So this is just a reminder, if you have any dollars in there, remember by the end of this year, you can only carry over $500. Anything above and over $500, it will be subject to forfeit. So reminder there. Dependent care accounts, they're still available. Remember, the money goes into a holding account for you to use to pay your daycare facilities. Now, if you enroll in the high deductible health plan, you cannot enroll in the FSA. You have to enroll in the health savings account, or that's the account that pairs with the high deductible health plan. You may enroll in the dependent care FSA, but not the healthcare FSA. It's kind of a double dip, if you will, and the government or IRS frowns upon that. So because they're both pre-taxed. So lowering your taxable income. Couple of quick notes here in UHC, some resources available. So when you get your ID card, if you're enrolling for the first time, I would highly recommend you go to My UHC, create your profile. That every time you go in there and you seek a provider, it will only map you to providers that are in network and in your area. So very important there. You have telehealth services available 24/7, 365, so you have access to that. Virtual visits with doctors that are providing virtual visits, that's all available as well. Nurse online, so you can call your nurse 24/7, 365 and talk about any interactions with medication, side effects, things of that nature, and they have your information at their disposal so they can speak to you specifically. Your dental plans we'll go over. This is a change from last year. Last year it was with Aetna. This year it moved to Delta Dental. Some of you may be enrolled already. The Delta Dental plans, you have two to choose from. So you have your PPO base plan. This plan provides your traditional dental plan. So you go in for your checkup twice a year. You have x-rays, preventative care, basic care, and major care, which I'll discuss here shortly. And then you have an allotment of dollars to use towards those services. On this first plan, the PPO base plan, you have $1,500 to use, you and every person enrolled in the plan, towards your services. Your preventative care, such as x-rays twice a year, checkups, for children, there's a couple of services that are going to be considered preventative. So take the children, get yourself for that cleaning twice a year, and you can schedule your cleanings anytime during the calendar year. It doesn't have to be every 6 months. It could be, whenever you think is convenient for yourself. Basic services such as cavity and emergency services, those are going to be covered under basic services. At that time, should you seek basic services or major services, you're going to be subject to a one-time deductible of $50 as an individual or $150 as a family. Major services, endodontics, periodontics, dentures, bridges, crowns, those are all going to fall under major services, and it's a 50-50 cost share between you and Delta Dental. Again, you have $1,500 to use towards your dental services, and then you get an additional $1,000 to use towards child orthodontia. Your next plan is a DHMO plan. On this plan, there's no annual deductible. Your preventative is still covered at 100%, and everything else is going to fall under a fee schedule, which means everything you look up the procedure you want to have done, and it tells you exactly how much you're going to pay out of pocket. This plan does require you to pick a provider because all of the care will be coordinated by one provider. Additionally, Delta Dental pays those providers for every time somebody enrolls or picks them as a primary dentist. So you can't just pick any provider. They have to be in the DHMO network. However, each person in the family may have their own dentist. So if you're going to a child specialist for orthodontia, they can go there. If you want to see somebody else for your services, you can do that as well. You can also change at any time. So as long as you do it before the 20th of the current month, your provider will be available for the first of the following month. So you just need to go into either the website or call Delta Dental and they can switch the provider. If you don't pick a provider when you're enrolling, Delta will assign a provider based on your home zip code. Again, you can go in and change it at any time. On this screen here is just an example of what the fee schedule looks like. So on the screen, you'll see periodontic oral evaluation, no cost. A lot of these services are going to be under preventative and at no cost to you. There are child orthodontia and adult orthodontia also available on this plan. Teeth bleaching is also available on this plan. So there's a whole list of services, and I believe I included that in the email that was sent out. Also, you see a letter here. This is what it looks like when you get your ID cards if you enroll on the DHMO program. It tells you who your dentist is, tells you how to change your dentist if you don't want to stick with that dentist. So it's very easy to use. Now, if you ever run into issues, please contact your team here at CVR and we'll be more than happy to help. Resources available either online or on your app with Delta Dental. You can find a dentist, see how much of your services you've used. You can take an oral health assessment, and then it can help you coordinate those services. Your vision plan is with iMed using the Insight Network. So they have both retail and private practitioners available. On this plan, your eye exam available every 12 months is going to be a $10 copay. You'll have a $120 allowance for any frames. Of course, the frames, the more expensive ones, you're going to have some out-of-pocket costs there, and you can use your HSA dollars or your FSA dollars to pay for those services. Your plastic lenses are going to be a $10 copay, so single vision, bifocal, and trifocal. And if you want any polycarbonate, scratch resistance, or anything like that, it's also going to be a copay versus a percentage of charge. And then also you have $80 allowance used towards your contact lenses. And then if you exceed the 80, you get a 15% discount anything over. Medically necessary contact lenses are going to always be covered at 100%. Now, in a calendar year, you can get your exam, your frames, and your glasses, or you can get your exam, your frames, and your contact lenses and pay for the lenses. So you can get all services 1 year. So the contact lenses and the lenses for your glasses are considered the same. So you can get one every 12 months. Voluntary life insurance. If you enrolled already in the voluntary life insurance with Unum, keep in mind if you have not exceeded your 5 times annual earnings up to $200,000 for that guarantee issue, you can increase it. So if you enrolled last year for $10,000 and you want to increase it and not go over $200,000, you may do so with no evidence of insurability, with no underwriting. You will not be denied. If you're a new hire or newly eligible, you're eligible for the 5 times annual earnings up to $200,000, again at a guarantee issue, which means no medical underwriting. You will not be denied. And then spouse, up to $25,000 of guarantee issue, and children is always guarantee issue at $10,000. If you want to exceed the $200,000, 5 times annual earnings up to $500,000, you may do so. Just keep in mind anything over $200,000 will be subject to medical underwriting. Short and long-term disability is still available. So short-term disability, it helps with maternity, a short stay, surgery, things of that nature. So it basically supplements your income or your paycheck. So it's covers 60% of your pre-disability earnings up to $1,000 a week. The benefit starts to begin after the 14th day, and the maximum duration is 11 weeks. Your long-term disability, again, 60% of your pre-disability monthly earnings, and it pays up to $7,500 a month. And the elimination period or the waiting period is 90 days. And the long-term disability does pay until age 65 or normal Social Security retirement age. We also have an employee assistance program that's available to all employees at no cost, so you can utilize this service as much as needed. You get 3 face-to-face or telephonic visits per incident. So if there's multiple things going on, you get 3 sessions. You do get free legal advice, expert referrals, financial services. There's a web portal you can access with employee discounts and resources. There's a huge library, there's training, mindfulness, well-being. There's a lot of resources available at Support Link. All of the services are 100% confidential. Your employer will not get a report in regards to what services you are accessing. So again, it's available to everybody that works at Kamper Estrada, and the information is in your packets and also here on the screen. The only thing you need to know is the password or username is CBR, all lowercase, when you access the website, and you can register and start using these services immediately, again, at no cost to anybody. You also have availability to enroll in AFLAC if you haven't enrolled yet. We have the AFLAC products available. Do I have anybody from AFLAC on the phone? Okay, so you have the ability to enroll in these products. If you already enrolled and you want to keep everything the same, nothing to do there. You have the accident coverage, the cancer coverage, hospitalization coverage. All of those coverages pay you directly versus a carrier, versus the insurance company, versus a hospital. They pay the member directly. So you just submit your claim. There's also wellness claims. So if you go get your wellness every year, you can submit that and get some money back into your pocket. If you go get a dental cleaning, that's also going to be considered wellness, and you get money back into your pocket. If you have any questions, I've sent everybody the information for our AFLAC representative, Jose Scheineman. You can email him, call him, or text him, and he'll be happy to have a one-on-one with you and go over the coverages that are available. Other offerings, Legal Shield and ID Shield, the United Pet Care, so we still have that for your pets. The only thing that's not covered there are fish. Everything else under the sun is going to be covered under that pet care. Couple things here. So if you're enrolling in the medical, dental, vision, or waiving, please send in your completed form, and I'll bring those up here on the screen shortly so you can take a look at those. Life and disability, only if you're making changes or enrolling for the first time do we need that. If you're updating if you have life insurance today and you would like to change your beneficiary, you can do so at any time. Keep in mind, in the state of Arizona, we are a community property state, so if you're legally married, your spouse does need to be dependent unless he or she signs a waiver. So again, only if you're making changes or enrolling on that life and disability. Your health savings account, if you're enrolling in the high deductible health plan for the first time, we do ask that you open that account so we have somewhere to put the company sponsored HSA dollars and your own HSA dollars. It's very important that you open it as soon as possible. The reason being is this plan is effective July 1st. So if you go to the doctor sometime in July, but you haven't opened your UMB account, you can't use any of those dollars to pay for previous claims. But if you open it and still with zero balance, as long as it's open before that first claim hits, you can fund that account with pre-tax dollars and company-sponsored dollars and put in that money into that account and pay for those services. Very important there. Again, all forms and everything is due by June 22nd, so we can process with United Healthcare and get everybody the coverage that they need. I'm going to bring up the forms that need to be completed. One moment, please. Good to see my grandson there. Let me know if you guys can see the form. Can you guys see the form? Okay, cannot see the form. All right, let me bring that up. Okay, so this is the enrollment form that needs to be completed and submitted by Monday, June 22nd. So very basic form. It gives you the information for yourself. Dependents need to be completed. We also need to have the social security number for your dependents. If it's the same dependents that you had in previous year or the current year, then you do not need to have that on there. Again, keep in mind that your employer does contribute to your health savings account. If you're going to add any of your own dollars, we do need that information filled in that yellow section. You'll see it on your form. Just let us know how much you want per pay period to go into your HSA. The dental portion here in the middle, this is the PPO plan is plan 1. The DHMO, you have to elect your dentist goes here. And then this middle section asks you if you go on the website and you want to pick your provider, what their code is. If you don't want to bother with that, Delta Dental will assign one to you. And then at the bottom, if you're not going to be enrolling, we do need a waiver, a reason, and signature. And then aside from there, again, if you're enrolling in the Unum plan, and please complete this, or if you want to change your beneficiary, complete this and just say change of beneficiary, so we'll have that for our records internally. Other than that, there are no other forms that you need to complete. Okay, the only form that we must have in by Monday is this first form. If you're enrolling in any of the other services, the forms are attached. If you're interested in AFLAC and meeting one-on-one or having a conversation with Jose, his information is on this form here. You'll see it, Creative Business Resources. You can complete this form, send it to me, and I'll make sure he gets it. Or you can contact him directly. His information is listed here on the bottom. So you can do it either way. Just an overview of the services that are available. If you want to enroll in the pet health care or legal shield, there's a link that you click on and go there. Same applies for the pet health care. There is a link on this page here at the bottom. Go to the unitedpetcare.com/CBR, enroll, and then we'll get the information and do the deductions from your paycheck. Okay. Any questions in regards to anything I've gone over today? Okay, again, this presentation will be sent out via a YouTube link later today for those that were not able to join us today. And I will send it to everybody. If there's someone in the office I missed, please feel free to forward all of the information and the packets so we can get everything back in a timely manner. Thank you so much for your time today.